Assalamualaikum warahmatullahi wabarakatuh. We are from 2B2 are going to present about chemical and chemotherapeutic methods to control microorganisms. We are going to present about antifungal, surfactant, and also awareness clip video. Okay, so what is antifungal? Antifungal are medicine that stop the growth of fungi or fungus that cause infection, called as antimycotic agents. So what is fungus? Fungus is produced through very tiny spores. These spores can exist in soil or become airborne. So fungi grow as moles, ears, or a combination of both. Fungi live on the skin, inside human digestive system, and vagina. Candida yeast in the body can also naturally occurring fungi. Who is at risk for fungal infection? These infections are called as opportunistic infections, life-threatening for people who have AIDS, autoimmune system such as lupus, cancer, organ transplant, stem cells such as bone marrow transplant. What do antifungals treat? Antifungal treats a normal skin infection, for example, athlete's foot, joint itch, and ringworm, dandruff, fingernail or toenail infection, yeast infection in the mouth, throat, or esophagus, vaginitis and vaginal yeast infection. Antifungals treat dangerous fungal infection, for example, aspergillosis, pneumocystis, pneumonia, and lung infections, blood infection, brain infection, syndrome eye infection, and sinus infection. Side effect of antifungals. So we have two side effects. For example, normal side effect from antifungals such as abdominal pain, upset stomach, diarrhea, itchy skin, burning sensation, or skin rash. The second one, we have a serious side effect from antifungal such as jaundice, allergic reactions such as anaphylaxis, allergic reaction such as blisters and peeling skins.
Next is the type of fungal infection. The first one is ringworm. It is called ringworm because it can cause circular rash that is red and itchy. The fungi that cause this infection can live on skin, surfaces, and household items. These fungi can infect your feet, groin, inner thighs, and even hands. Ringworms on the skin can usually be treated with non-prescription antifungal creams such as clotrimazole. The second one is sporotrichosis, that is also known as rose gardener's disease, is an infection caused by fungus called sporotrix. These fungus live on soil and plant matter such as sphagnum moss. These fungus can enter the skin through a small cut or scrap. The most common treatment for sporotrichosis on skin is itraconazole, taken by mouth for 3 to 6 months. Third one is histoplasmosis, that is caused by fungus called histoplasma. This fungus can live in environment that particularly soil that contains large amount of wet or bed droppings. People can get histoplasmosis after breathing in the microscopic fungal spores from the air. Itraconazole is one type of antifungal medication that's commonly used to treat histoplasmosis.
Medication divided to 8 groups of compounds. First, polyins, antifungal agent, amphotericin beta, nystatin. For mechanism of action, bind to ergosterol. Next, azoderivative antifungal agents, miconazole, ketoconazole, flunaconazole, and itraconazole. Mechanism of action is inhibit cytochrome P450 dependent enzymes. Next, nucleoside analogues. 5-fluorocytosines. Mechanism inhibits DNA and RNA synthesis. Glycine, glycofulvin. Mechanism is inhibits microtubular function. Alamanis, niftifin, terabophin. Mechanism for succulin exosidase inhibitors. Thiocarbamates, clonaftate, tosylate. Mechanism of action is squalene exosidase inhibitors. Next, merfolines, amorphine. Mechanism of action is inhibits ergosterol biosynthesis. And the last one, echinocandins, caspofungin, and anidulfungin. Mechanism of action is B1,3-glucosinthase inhibitors.
Hi, I am ASYIQIN and I will explain about surfactant. What is a surfactant? A surfactant is a substance that when added to a liquid reduces its surface tension, thereby increasing its spreading and wetting properties. Surfactant also creates self-assembled molecular clusters called micelles in a solution, which is water or oil phase, and adsorb to the interface between a solution and a different phase, which is gases or solids. So, do you guys think soap and detergent are considered as surfactant? The answer is yes, soap and detergent is surfactant. To show these two physical properties, a surfactant must have a chemical structure with two different functional groups with different affinities within the same molecule. As you can see, at the figure given, there's two different functional group, which is hydrophobic group, which is the tail, and hydrophilic group, which is the head of surfactant. Move on to the next slide. How do surfactant work? Usually, surfactant is used for cleaning because the function of surfactant is to kill bacteria by breaking up the cell membrane components such as lipids and protein. As I said before, the polar, which is head, is hydrophilic, which is water-loving components, and the tail is non-polar hydrophobic, which is water-hating components. The head will attract to the water while the tail will attach to the lipid layer of cells, which will cause it to break apart. Imagine you want to wash your hand because your hand is full of dirt. So you take the soap, which is surfactant. The tail of the surfactant will attach to the dirt that was on your hand. So when you wash your hand that full of soaps with water, the tail will pull the dirt away from your hand. So your hand is clean now.
Next, I'm gonna explain about type of surfactant. Surfactant have four types, which is non-ionic, anionic, cationic, and amphoteric surfactant. Okay, for the non-ionic surfactant, is surfactant that have no charge in their hydrophilic head. For example of non-ionic surfactant is polyethylene glycosylate and rauryl alcohol acetoxylate. This non-ionic surfactant used as a grease remover in detergent, household cleaner, and dish soap. The second one is anionic surfactant. Anionic surfactant is surfactant that carry negatively charged in their hydrophilic head. For example of anionic surfactant is ammonium laurate sulfate, sodium laurate sulfate, sodium laurate sarcosinate, and the others. The function of anionic surfactant is used to remove dirt, clay, and oily stains. The third one is cationic surfactant. Cationic surfactant is surfactant that have a positively charged in their hydrophilic head. For example of cationic surfactant is methylbenzethonium and benzalkonium. This cationic surfactant used for fabric softener, disinfectant, personal care products, and the others. The last one is amphoteric surfactant. Amphoteric surfactant, also called as zwitteronic surfactant. This surfactant carry both a positive and negatively charged in their hydrophilic head. Example of amphoteric surfactant is betainase and amino oxides. This amphoteric surfactant used in personal care products such as shampoo and cosmetics.
Surfactants play an important role as cleaning, wetting, dispersing, emulsifying, foaming, and anti-foaming agents in many particle applications and products. We can find application of surfactants in daily life such as household care, textile, personal care, painting and latex, pharmaceuticals, oil and gas, agriculture, and paste industry.
Ow. Why Shikin? What happened to you? It hurts badly. I think you got food acne. Seriously?
Okay, students, so now we are at the end of our lecture today. Any question, I will answer it for you. No, miss.
Should I ask you about English? Should I?
You know about my English, right? Should I ask Miss Nadira about this? At least I know what to do next. You should. How about you ask Miss Nadira in person after this class? Yes, definitely. You're a friend.
Okay, guys. See you guys tomorrow. Would you like to join me to go to Pika after this? Yes, of course. Let's go, Raja.
We have something to do after this.
Oh, it's okay. Goodbye. See you guys tomorrow.
Yes, can I ask a question?
What question?
I have something on my foot. I have it for too long, but I don't know what it is.
Something? What shape? Does it hurt?
Yes, it is.
Can I see a picture?
Yes, I have a picture.
Ashiki, this seems like a fungal infection. Why not go to the health unit? It looks bad. Don't delay getting a treatment before it gets worse.
Seriously, miss? I think it's just a normal scratch since I'm an athlete. Alright guys, thank you for the information. I will take your advice. Hello Kak Raja. May I know what can I do if my feet was affected by fungi? I don't know what to do. I already give you the picture through message.
Sorry dear, hi, how are you? Sorry for not picking up your phone just now because I have a lot of patients, so I have a free time right now. So based on your picture that you sent to me, let me explain to you what happened. It actually happened due of conditions like weakened immune system, introduction of new fungi to an environment or travel to an environment with excessive fungi and caused by a fungus. So, fungus is produced through very tiny spores. In addition, the spores can exist in soil or become airborne. The infection can also spread from one person to another through direct contact. But the most common fungal infections, like what you have been going through right now, like those on your skin or nails, are not usually serious. But if you have a weakened immune system, you are at higher risk of serious illness from certain fungal infections. My advice to you, go to health unit as soon as possible, okay? So, that's all from me. Bye. See you next month. Bye, dear.
Okay, thank you so much Kak Raja. See you soon.
ASYIQIN FARZANA. This is the remedy for your athlete foot. The way how to use it is by applying the cream direct to your affected skin. You need to apply twice a day until a week. After the rash clears up, in case if you forgot how to use it, you can see the instruction at the back of the cream. So yeah, don't forget to make a payment at the next counter and get well soon for your active food.
Did I do anything?
Shower the smell. When is the last time you washed yourself? I think I haven't been washing it for a week. Are you serious?
You should have washed your soap. That's why your feet didn't move yet, even though the doctor gave you antifungal cream. This is the detergent I recommend for you.
I will take your advice. I want to buy this detergent. Okay, it is 13 and 49 cents. Okay. Here you go. Thank you. Okay. Hello, Ain. I just want to inform you that my feet already healed. Thanks to Madam Nadirah and my cousin, who is a doctor, that give me advice on how to heal my feet. By the way, big thanks to you guys too.
who give me advice to wash my socks often. I will not forget that. Never.
Hello ASYIQIN. Seriously, I'm really glad to hear about that. Next time, I hope you remember to take care of your hygiene if you don't want this to be happen again.